I mean, naturally, you don't expect to go to hospital and catch something. Let's start with that.
Absolutely not. And these figures are rather scary if they are to believe in the format that they've been presented. I'm very fortunate the region that I'm living in was actually singled out as one of the places with the lowest prevalence. So it's not something that we're experiencing locally. However, it's important to question how they are getting to these figures because many people who are coming in with COVID would only test positive 2 to 3 days later. Are they being included? And the
Right.
question then about where are people catching COVID from? Is it from the visitors or from the staff or from other patients?
And it's interesting because there's another way to look at this, and that is that if there is a virus going around, then by definition, some might say, well, a hospital would be an obvious place where you might get it.
Absolutely. I mean, at one point, 1 in 15 people in London had COVID. And therefore, people coming to hospital for other reasons, 1 in 15 of them
Yeah.
will be carrying the COVID virus. Now, we know COVID makes any other illness worse. So, if you've got heart disease, you're more likely to get problems. If you've got diabetes or ulcerative colitis or any
Mm.
inflammatory disease, it makes all of those other diseases worse. So, it's not that much of a surprise that if you catch COVID, it will make your other conditions worse.
Yeah.
Then you will be left in hospital with COVID exacerbating your other problems.
What is a hospital supposed to do, though? I've been in a hospital a couple of times in the last couple of years. I had a procedure and spent a night in a hospital as well. And what I noticed, David, and I'm sure it's the same in your hospital, was that everybody was very good and very rigid about hygiene and rules and regulations. And even when I came around from my anaesthetic, the first thing that happened was a face mask was plonked on me as I was wheeled to the ward. So every box seemed to be ticked. So this isn't just a case of hospitals not caring.
Absolutely not. So every patient on arrival into hospital will get a PCR check, irrespective of why they're there. We're looking to find out, are you bringing COVID into the hospital? Is that part of the underlying causes? That is also then happening at least twice a week in every single patient that is in hospital for other reasons. All of the staff members are being regularly checked with our lateral flow tests at least twice a week, if not more frequently. And of course, we're also wearing the masks both for our own protection and a lot more for the patients, the people we care for, protection. The whole vaccines issue is coming into this about reducing transmission. And I know that is a very controversial area in its own right, but that is something else that we're doing to protect the patient that we are caring for.
How is it going? Just on a separate point, but feeds into this whole narrative. There's lots of figures about NHS staff who aren't jabbed at the moment that may be forced to leave the profession. Do you think it's going to come to that?
It's a very controversial issue. So there is no doubt that the double vaccination plus booster is the reason that we are not seeing mass hospitalizations at the moment. The safety of the vaccine is undisputed. And there are still these misconceptions about can we get the vaccine? Do we need the vaccine if we've already had the disease and those sorts of elements? And the simple answer is yes. I can go into reasons if you like. But actually, the bigger problem is going to be encouraging both the healthcare workers and the wider population that this is the case. Now, the small numbers of healthcare workers who aren't vaccinated are actually spread across the board. Very, very few doctors, very few nurses have not been vaccinated. But remember that the NHS runs with effectively a hotel services. There's a catering, the cleaning, the porters,
Sure.
and that's the population we're trying to reach at the moment to encourage their vaccination status.
David, thank you, sir, for your time. Dr. David Strain, he's the lead COVID, clinical lead for COVID services at his local hospital and senior clinical lecturer, University of Exeter.